Good evening and welcome. On behalf of our General President, Brother Willis Lanza III, and our Board of Directors, I am Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity. This evening is a bit of a somber conversation, but I think it's something that's pretty important. It's so important that I want to take care to stage the conversation this evening before I bring on our guest. This is not going to at all be a political conversation, but just something that we as brothers and as a community should be aware of in terms of what the actual issues are related to gun violence and gun shootings. One of the things that may surprise you, and before I even do that, just let me frame this for you. In my personal background, I am an emergency physician and I have been a department chair at three different level one trauma centers that deals with these things directly. One in Milwaukee, Wisconsin, one in Washington, D.C., and one in Fort Worth, Texas. So I've been dealing with this matter hands on for about 25 years. And on an even more personal level, um, as is so often, too often the case for members of our community, I actually lost my father to a gunshot when I was just 6 years old. So I have been fascinated by this conversation, but I do recognize that there are many different ways to come at this conversation. And this evening, we will be attempting to do just that in a way that discusses best practices and empowers you, the viewing audience, on things that you can do to lower your risk and your family members' risk for being a victim of gun violence. You know, there's a couple of points I want to bring on at the very beginning. Although mass shootings seem to draw the most attention, and believe me, they have been proliferating in a very unseemly way, these incidents actually only account for a very small fraction of the gun violence that occurs each year in the United States. Far more common are incidents of interpersonal violence, suicides, and other unintentional shootings that become fatal because of the easy availability of guns. And as luck would not have it, the burden of this violence often falls disproportionately on urban communities and communities of color. Read there on Blacks and other African Americans and other Blacks. One of the more disturbing trends that has occurred of late is that gun deaths among children and teens has out of nowhere, seemingly, not quite out of nowhere, but has become the number one cause of death in ages between 1 and 44, and certainly amongst children, which is especially disturbing. Um, it's hit a record total in several of the last few years. Back in the first year of the pandemic, there were 1,732 deaths. That's 2019, and then rose in just 2 years to what the CDC has revised its numbers to say is now 4,752. That's more than a doubling in just 2 years for individuals between ages 1 and 19. Of that amount, 80% of those deaths occur amongst males. And when it does occur in Black Americans, we tend to be the victims of homicide, which is an interesting contrast to when it occurs amongst white males who are more likely to kill themselves with guns. Against that backdrop, I'd like to introduce our guest for this evening, and he and I will be having a fireside chat, if you will, on this topic. I might like everyone to welcome Brother Hakeem Stovall, who was the first person selected for a postdoctoral fellowship, and it's supported by the Robert Wood Johnson Foundation, which means to support research, training, and development of researchers who examine important issues pertinent to equity and policies intended to curb gun violence. Brother Dr. Stovall completed his BA in criminal justice and his MS in adult education from Cheyney University of Pennsylvania, which is where he also pledged Alpha Phi Alpha's Beta Pi chapter. He got his doctorate in social science and prevention science from Wilmington University in 2021, where his dissertation research examined a reincarceration prevention program and predictors of successful reentry back into society. In addition to working on the District of Columbia's Medical Examiner's Office Fatality Review Committee, Dr. Stovall has many years of experience in human services, public health, and community corrections. So we're going to be bookending this conversation, me from the clinical side and Brother Dr. Stovall from more of an academic consideration. So with that being said, welcome, Brother Dr. Stovall. How are you this evening?
Good evening, Brother Sterling. Thank you for having me on tonight.
Very good, very good. So let's just start the conversation because I don't think that people really understand um, what it is someone like you would do and how that actually plays into crafting solutions for this type of plague. So just give it a minute or two, if you will, and tell us a little bit about what you do, how Johns Hopkins and Robert Wood Johnson Foundation are working to try to create solutions, and then we'll get into some of the things that we know actually work and don't work when it comes to the conversations about legislation that could and should be passed, legislation that does and doesn't exist, and what we as individuals can be doing to lower our risk. So take it
Sure.
away.
Well, first, I want to take a couple of steps back, uh, focusing on the impact and trajectory that gun violence has had on me as as a youth growing up within the society of West Philadelphia. Uh, through traumatic instances that had occurred within my life, I was allowed or given the opportunity to work with the Philadelphia Medical Examiner's Office at a young age of 18, upon which I was able to mature and develop a skill set of understanding fatality review. And when we think about fatality review, it's basically a concept of exploring what's called adverse childhood experiences of decedents and the relationships that those individuals have developed over time. What level of impacts have affected them throughout their childhood experiences, leading towards their death. And so by generating and exploring through those experiences, it granted me an opportunity over time to work with the DC medical examiners, upon which I started working on the Gun Violence Fatality Review Committee in Washington, D.C., exploring the impact and the rise as it relates to gun violence fatalities within the jurisdiction of the District of Columbia. Uh, when focusing on those particular cases, it gained the attention of Dr. Cassandra Kafasi,
Mhm.
who is the co-director of the Johns Hopkins uh, Center for Gun Violence Solutions, which is located on the campus of the Hampton House, located directly across the street from um, the Hopkins University Hospital. And basically, the premise behind this program or this department is to primarily focus on evidence based strategies to effectively try to mitigate the circumstances and the factors that are related to gun violence as a whole. And when we think about how we can impact and make change and come up with various ideas as it relates to the development of trying to engage in a credible uh, solution. We think about policy. Basically, the responsibilities of fatality review were to review the elements related to the individual decedent's death and come up with effective ways of programs and societal factors that have impacted the individual over time, leading to their death, to come up with ideas that would help uh, disrupt the ripple effect, so to speak. And so, in alignment to the Johns Hopkins program, developing programs that um, or an agenda that would focus on gun purchaser licensing uh, restrictions in various states, advocacy through policy, and extreme risk protection orders, conducting research on various aspects as it relates to new and emerging and trending impactful ways that uh, we've never seen in terms of uh, impactful gun violence related events.
Mhm.
Um, and so basically, as we, the program as a whole is a 2-year program engaged in working on different research projects as it relates to gun violence, um, identifying effective ways that we can try to help mitigate those circumstances, and then also to be able to provide experiences and partnerships with other agencies to help work towards a common cause to help mitigate these particular circumstances.
Yeah, but this is where we have to be very careful
Hmm.
because, again, I'm right here with you, so I say this out of love. This cannot be an ivory tower conversation,
Sure.
but we need the ivory towers. And again, I have my master's in public health from Harvard, so I'm right there with you.
Hmm.
But this is where we have to settle on a couple of ground rules when we're having this conversation. I
Sure.
think we have to acknowledge that we are a country that, for better, for worse, for interpretation or misinterpretation or misappropriation, the Second Amendment has become the law of the land in quite a feverish way. So, having this conversation has to occur in the backdrop that this nation has decided that it is going to be a gun toting country, and the ramifications, therefore, have to be respectful of the fact that so many Americans actually, for better or for worse, want to deal with guns and want to live and or die with guns. So I just kind of want to throw that out there because I
Sure.
think that people who are listening to this conversation need to know that, we're not going to have this conversation today out of any bias or out of any leftward notion that guns are necessarily a bad thing. We acknowledge where the country is on this conversation, but
Mhm.
even within that context, I think it is fair for us to have certain um, discussions about certain very specific points. And let me start with this one, and I'll toss it over to you to get your opinions.
Sure.
I do think that it's unreasonable that in our country, we are not even allowed to research this question in the way in which we should. There are pretty significant funding restrictions on gun violence research. I think that if you just looked at mortality rates and funding levels for other leading causes of death, there should be about $1.4 billion in federal research money that's um, don't appropriated toward gun reducing gun violence deaths. Instead, I think the number is about 22 million that is allowed in research, just 1.6% of that amount. Just in contrast, um, it's 5.3% of federal research funds actually go toward looking at motor vehicle accidents, which kill similar numbers of Americans, much less than what's happening now with gun violence. And as I recall, California actually has become the first state to take it upon themselves as a state to start funding research into gun violence and how to reduce that. So, as a result, we know a lot less about gun violence as a cause of injury and death than we do pretty much about most any other medical problem. And I think that, correct me if I'm wrong here, you should know this better than I, but I think it was in 1996 when a congressman named Dickey, it's the famous Dickey Amendment, actually passed a
Hmm.
law that mandated that no CDC funds could be spent on research that could be used to advocate or promote gun control, which is an amazing thing for a Congress to have passed. So, with that amendment in place, it's called the Dickey Amendment, we actually are limited to a certain extent, to a large extent, and our hands are tied about at the beginning of the conversation, even being able to research best practices that could reduce gun violence. You want to have any comments on that or any clarification?
Sure. Well, first off, we need to understand that this this particular public health crisis is a multifaceted. Uh, this is a multi faceted event that has different perspectives. Where when we think about resolution, this isn't like one of those situations where there's like one pill that's going to resolve uh, the the crisis or the situation at hand. I think what we need to understand is that uh, different states have different policies in place that uh, that are favorable for individuals that carry firearms versus individuals who uh, who are more so against gun violence in relationship to, for example, uh, gun purchasing laws that are recently being advocated for in various state jurisdictions. We have cases where individuals will lobby for stricter enforcement as it relates to the possession of firearms. Uh, as in addition to that, training and other related supportive safety practices that are necessary for individuals to be able uh, to possess these firearms, so to speak. I believe that uh, some states are in favor of funding as it relates to uh, training, understanding a more systematic approach in terms of the response of uh, how how individuals within those state jurisdictional communities respond as a whole, and ultimately how we are going to uh, acknowledge what's important, based off of the leaders in government to this, at this point in time, on how they wish to appropriate funding in terms of research and expenditures as it relates towards the uh, uh, gun violence safety versus gun violence research, uh, and more systematic and programmatic ways to help uh, impact society as a whole. It's like a favorable government type
Yeah, let me
situation.
let me jump in there because I think I want to make it clear for the people that are listening what exactly we're talking about, and we can reduce this down to a simple construct. As is currently constituted, our policy is either laissez faire or let them eat cake. I just want to make it clear that it is impossible, nearly impossible, to come up with a slate of best practices when you aren't even allowed to research the topic. And that is where we are on a federal level. As you say, several states, particularly those that are left of center, may be inclined to address those issues within their states. But in the same way, and let me toss another example to you and do a segue here. The premise of buying a gun should be like buying a car has long been cited as a reasonable step in this regard because handguns are responsible for 90% of homicides approximately.
Hmm.
So you simply had an effective policy of having people obtain a license that includes a registration of all purchases and at least a modern training program. That in and of itself doesn't get at prohibiting people from acquiring weapons. It just means that we're going to be more responsible in terms of how guns are used. And that seems to be a sensible, good government proposition for a country that is a gun toting, gun loving country, which we are. But we can't even do that because any reform, anything that promotes gun safety as a conversation still runs up against the powerful lobbies that want to prohibit this type of thing. So in that backdrop, just tell us, and again, I want to get over back to you and what the work you're doing at Johns Hopkins. Tell me how you and your program actually try to navigate and circumvent the notion that research really isn't something that's being supported federally, even on that level. Because before I toss it back, I'll just point out the one thing. Another state that's relevant in this conversation is Missouri, which back in 2007 actually repealed, excuse me, its permit to purchase handgun law. And what was seen immediately thereafter was a 25% increase in firearm homicide rates. So, how are you thinking that you can get past and get to research that actually makes a difference for the citizens if we're dealing with this obstacle at the very beginning of the conversation?
Sure. Well, first and foremost, I think we need to identify when we talk about the rise in gun violence and the various related demographics as it relates to uh, gun violence. We need to understand, number one, looking at empirical data. When we take a look at the empirical data, we discover that the rise uh, amongst all demographics, whether it be suicide, homicide, uh, uh, etc., we take a look at the impact that COVID has had between 2000, uh, 2019 and 2022, upon which, uh, when we were at a state of a national crisis, upon which individuals started to, uh, there was a rise in uh, purchases and sales of uh, of automatic weapons, ammunition, things of that nature, uh, and also we also have to take into account the impact that the level of mistrust that, based off of the post George Floyd scenario, has placed upon society as a whole, where a level of mistrust between uh, our society and public safety has typically made and created a, a surmountable impact amongst individuals and societies of color. Now, reverting to your question, uh, in terms of the research and the relationships that Johns Hopkins is beginning to focus on, our number one our number one emphasis in terms of our research and role into looking in and exploring areas of gun violence and gun violence prevention, uh, we our general role is to look into understanding evidence-based practice, number one, um, trying to come up with effective ways of mitigating the circumstances, number two, focusing on, well, my research in present, I will be reviewing the impact that victim services have towards individuals uh, within poor socioeconomic communities, primarily, predominantly Black communities that uh, have been impacted based upon um, the trend of gun violence and the emergence of the public health crisis that has uh, been at a surge within the city of Baltimore, and exploring uh, how impactful has the uh, has their services been. And basically, the Robert Wood Johnson Foundation is using this platform to explore how impactful services have been towards the trajectory of services towards individuals that have been affected. And I lead into discussion about how individuals were impacted post COVID and in post Freddie Gray and post George Floyd, because within the city of Baltimore there is a surmountable degree of mistrust upon uh, individuals of color and individuals who work within the sector of public safety. And so, a platform to research and try to help build equitable circumstances as it relates to the research, being able to help generate evidence through research to help individuals understand what it takes in order to create a bridge of understanding, not only just to create a bridge of understanding, but also to be able to have uh, information on hand uh, after the research is completed, to be able to have something that is evidence based that an individual can be able to review uh, and replicate those circumstances uh, to somewhat help reduce the circumstances that are related to the public health crisis. If this pretty much uh, is a parallel to what you asked.
Yes. So let's actually take what you just said and talk about one specific example of something that is evidence based. Because uh, activity is not the same as accomplishment.
Right.
And I say that because in emergency medicine, we often talk about things that are drama and things that are trauma. And things that grab the public's attention or an individual as a patient that are more visually dramatic tends to be the squeaky wheel that gets the oil. But the all day, everyday trauma is something that if you're going to actually reduce deaths, you would do well to focus on those. So, what I'm getting at in this example is that the military grade rifles, the AKs and others that are used in many mass dominate the political debate, but actually they account for less than about 5% of homicides. So focusing all of our attention in the political debate anyway on assault weapons bans is a thing that is absolutely necessary because these mass murders need to stop. But all day, every day, there are accidental deaths, there are suicides and homicides, domestic situations, and that's really where the bigger part of the conversation is needed to be had. So, as a best practice, I'm just going to toss it to you and let you expand on it. Background checks for all private sales and restrictions on multiple purchases, for example. These are things that we know are associated with lower rates of gun homicides. You also mentioned extreme protection orders, also known as gun violence restraining orders, where a family member could petition the court to temporarily ban an at risk person from buying firearms. Those are two things that we know lower homicide rates in the whole and is a not as dramatic a thing as saying someone got shot up at a church or a store, but these things result in much higher numbers of deaths over time. And can you just talk about or reaffirm what I'm saying, rebut it or add to it or expand
Sure.
upon it the way you choose?
Sure. One of the things that the Hopkins Center for Gun Violence Solutions is steadily trying to enforce are changes in policy within state legislation. The there are various issues that are related to that we're trying to identify and mitigate. For example, if you go to one particular state in general, like if you go to uh, Chicago, and uh, there is a licensing uh, order put in place, or gun licensing purchase policy put in place for the state of Illinois. Uh, Individual can easily go to another state. There's a loophole there. It can go to another state and be able to purchase uh, a large capacity, a rifle that holds large capacity magazines, which pretty much puts the emphasis and the focus behind access to firearms within the state of compromise. Um, Extreme risk protection orders. When we think about extreme risk protection orders, you know, just to just to dive in a little bit on that, the purpose of the extreme risk protection order uh, is to also help to examine the individual's application on a more thorough basis. If individuals have domestic violence background or a previous domestic violence background um, that comes into question when going through a particular application system. And if that's the case, then the public safety or law enforcement comes into play, enforces the restriction, and tries to mitigate access for individuals who fall under that demographic to have access to firearms. I think that the compromise that comes behind those two specific topics, and particularly, are the fact, once again, as I said earlier, um, state legislature and state governments as a whole, they have there are different views and different values as it relates to the right to bear arms. And so, uh, you know, until there is complete transparency across the board on a much more national scale in terms of the approach of the some type of methodology in place or a plan in place to be able to uh, help uh, to uh, to slow the progression of gun purchases down. We're consistently going to go through a process where some laws are for the protection and some laws are against it.
That's amazing, isn't it? And yes, Illinois did just pass an assault weapons ban that does allow for a loophole, but again, was much acclaimed because it was progressive. But in the whole, we will see whether or not that amounts to more activity or actual accomplishment. One thing in particular that is of interest to those of us who are boots on the ground, that I'm fascinated to get your thoughts on, is the fact that physicians, and I'm sure the people in the audience will be shocked to hear this. Um, just let me make a point before I get into that. The youngest child that I've seen that was a victim of a gunshot wound was actually 4 years old.
Mhm.
And I am familiar with there's a famous case when I was in Cook County in Chicago where at a Taste of Chicago, one of the summertime festivals, a random gunshot actually got through a kid that simply was in a stroller, and they ended up coming into our trauma center. In Texas, I actually have seen a child as young as 4 years old who came in, um, who was being trained how to handle a weapon, and with the fire and other such things came in with several repercussions of that actions. So, the studies actually suggest that some 3-year-olds are actually strong enough to shoot a gun, and by the time kids reach school age, approximately 75% of them can carry a weapon. So, as you keep pointing out, there are states, and Texas is one of them, where when you can't see a house, literally almost, without knowing that there's a gun closet somewhere um, on the property. So I bring that up because when I saw these kids that were as young as 4 years old, you might be, not you, but the audience might be surprised to know that as a physician and even a traumatologist, I am actually quite limited in what it is I can discuss, how I can educate families when it comes to gun safety. And one of the beautiful things about emergency departments is that whether you're having a heart attack, and you're talking about smoking cessation or other such things, that is the perfect time to introduce conversations about preventive health. And it is the point in time in which people are most likely to make defined changes in their lifestyles. So the inability for doctors to talk to patients about guns, even when that presents a health risk. So again, 26% of the women that come through emergency departments, even after we screen everybody, but 1 in 3 women, up to 1 in 3 women, and up to 1 in 4 men actually are victims of domestic violence. And we screen for that. But even as we screen for that, we're not able to continue the conversation and to talk about the specific threat that guns represent. And there's a law out of Florida back in 2011 that literally had at suspending medical licenses and imposing fines if physicians inquired about the presence of firearms in the household. Now, that actually resulted in a lawsuit over First Amendment rights. It was famously called the Docs versus Glocks case, and the physicians won that case and overturned the law. But there are states, the M's, Minnesota, Missouri, and Montana, actually limit doctors' ability specifically to to have these conversations. But
Mhm.
it just stands to reason that we are missing a powerful tool in the fight to promote safety. Again, this is not a conversation about removing anyone's firearms, but even the conversation about safety is limited. So let me just toss that to you and get your thoughts, and see if you're familiar with any either legislation or research that is trying to strengthen that set of tools that we could be working with.
Well, I want to peg back for a minute when we were just when you brought up preventative health.
Mhm.
The num I was leaning on the understanding that, number one, we have to come to an understanding that we are at a place where you and I, uh, you know, we're probably not exactly the same, age, but we have to have an understanding that uh, as peers to a lot of these younger kids, that new things are beginning to emerge within, you know, uh, uh, within society as a whole with younger kids. Uh, when we think about preventative steps, uh, we have to figure out, where and how uh, these these events have come down to a point where individuals are now possessing these handguns. Uh, why is it that there is a need for them to carry these handguns? And effectively, what can we do in order to help shift change, uh, to help impact that, or create some type of a ripple effect, um, in terms of helping those individuals reduce those particular circumstances or these practices that a lot of the kids are doing. And the one thing that we have to understand is that we are in a place where we're in a cultural shift. You have to understand that um, we are operating under traditional values, under traditional laws that we've abided by over the years, and now most recently based off of the impact of uh, the level of mistrust that individuals have for law enforcement and how individuals want to take things on for themselves. Uh, the amplified approach through social media outlets have definitely uh, put a tremendous impact uh, in terms of the psychological perspectives of uh, how those cultural norms have been broken down. And I believe that when we discuss introducing new laws, new concepts, we have to adapt as a society as a whole in terms of recreation of, uh, you know, coming with fresh ideas, new approaches. Uh, you know, because of this emerging trend, we see a loss in public safety, drop in individuals who've worked in public safety as police and general things of that nature. The level of employees as it relates to police individuals who work in law enforcement have dwindled, which have left individuals at a young age to be able to and I've had an opportunity to speak with a lot of individuals who are police officers, investigators, things of that nature, and they ultimately believe that there has to be certain changes in policy um, as it relates to the supervision of our young people within various communities today. Uh, when we discuss policy, when you focus on policy, identifying where those particular barriers are, uh, understanding that the the data as it reflects to CDC and homicides and suicides are primarily related to a young black demographic between the ages of 15 and 30 years old, uh, within our nation as a whole, in that African American men are the leading causes or the leading demographic as it relates to these particular firearm related demographics. That by focusing on uh, effective change, understanding the what's called the, like, once again, the adverse childhood experiences of those individuals coming from various backgrounds, and how psychologically they are impacted, more of a social support system, more of a psychological support system, uh, not focusing on so much uh, of a penal and more punitive response to individuals uh, that are either the perpetrators or victims of these events, but to come up with concepts that are fresh, that are new, that approach individuals at a level where um, they're supportive and they're engaging. And so I hope that that pretty much concludes or answers your question, so to speak.
Yeah, this is pretty fascinating. And again, I do want to pivot in our last 10 or 15 minutes. I do want to pivot to some community-based considerations in this conversation. But at the beginning of it, I'm really just trying to set the groundwork for best practices that we know we could be addressing as a society. So
Hmm.
let me just throw two more topics out for you to address before we pivot in that direction. One is the concept of smart guns. Technology has infiltrated so much of what it is we do, and the data actually suggests that 60% of gun owners would be willing to use smart gun technology such that your fingerprint would have to match in order for the gun to discharge, basically. So, and it was a Johns Hopkins study back in 2016, as I recall, where that data came from. One other thing that I wanted to have you speak on is 20, no, it was 2005, the Protection of Lawful Commerce in Arms Act that shielded gun manufacturers and sellers from civil claims. So that's a powerful one-two punch. I do recall recently um, some of the gun manufacturers saying we're not a technology company, we're a manufacturer, as an excuse for them to not deal with that. But of course, once they got shielded back in 2005, the incentive for them to look at this as a business opportunity and to sell smart guns went away. But as a means of avoiding unintentional injuries, obviously the smart gun technology is something that would work. And clearly, if the gun manufacturers were made held some degree of liability, just as occurred with the tobacco industry for the actions of guns that they sold to individuals that they could have and should have known shouldn't have had these things, and that would make a huge difference. For those two things for me.
Yeah, well. First and foremost, brother Sterling, I'm new to the scene, so I'm still getting a lot of intel, and getting a lot on my feed right now. But I will say this: the idea of a safe gun sounds like a wonderful solution to help mitigate access to firearms. I think right now, what the agency's focus has been examining the emerging trend of ghost guns and the and how to eliminate or try to uh, trace information as it relates to the parts uh, that manipulate the firearm parts that are existent, and trying to reduce the production uh, and sales of those particular artifacts. But uh, you know, to answer your question, uh, I believe that research. I'm not really too knowledgeable about the information as it relates to those particular guns that you described, but I believe that any um, effective strategy as it relates to trying to mitigate circumstances that are related to accessibility to being able to use a firearm where it's only limited by uh, some type of biometric coding, so to speak, to be able to, to use that gun to, for the purpose of defense or law enforcement or whatever the case may be. That's definitely an ideal solution that should be explored, and I believe that is being explored in terms of just helping to mitigate the threat. But in terms of the research, those particular questions that you asked, not really too keen on those particular points. Just like I said, just pretty much getting started. And you call me back at another time, I'm sure I'll be able to fully
Yeah,
be able to provide all that intel for you.
it's okay. I'm a little bit longer in the tooth than you, so I know some of this stuff. And again, as we segue into community considerations, I just want to point this thing out. Um, Domestic violence is Domestic Violence Awareness Month, and I just want to reaffirm the points that were made earlier. we had a recent 10-year period in which over 6,000 women were murdered by an intimate partner using a gun. And the presence of a gun in one's household increases the risk that a woman will be murdered by 500%. We have got to, as a cultural consideration, get away from the notion that hypermasculinity and pistol whipping each other, or even brandishing a gun. Um, no, 4.5 million to 5 million people in this country have been threatened by a gun by an abuser, and we have got to deal with that. So, we're keen, and we will talk about the ways in which the police and other components of societal considerations promote gun violence in a completely different way. But let's pivot the conversation to how we can become more empowered to use guns safely. And I kind of want to, not even facetiously, tee up a question for you to see how you would answer this one. We always hear the meme, the trope that the best way to stave off a bad guy with a gun is to have a good guy with a gun. Can you speak to any research about which you're aware that either refutes or confirms that notion? Should we be promoting greater gun usage with safety in the Black community as a way to overcome this, or should we be more on the side of trying to eliminate guns? Again, in mind the societal inclination on this matter.
Well, and I'm glad that you asked me that question because I literally was in a roundtable discussion with a couple of peers and a few of my peers, and we focused on the topic of individuals that buy guns for protection versus uh, the victims versus the perpetrator. And the equation still doesn't really add up into anything that's positive. Whereas you may have an individual who may purchase a gun to say that, they want to protect themselves versus uh, an individual who has purchased a firearm with an intent to cause bodily harm or crime or anything that uh, relates to a negative connotation of a person possessing a firearm. What we need to understand is that outside of those two individuals that purchased those firearms, that there's a whole society around those individuals. What if there was an exchange, a fire, some type of activity where there was an exchange? Think about the level and the trajectory of impact that it could potentially place on individuals surrounding those particular events that happen. In most cases, I grew up in West Philadelphia. So, right now there's an emerging trend of, of violence at an all-time high. And so when we think of that, there are victims, potential victims, uh, y- that may be affected. There are individuals that, there's a traumatic level of impact, is what I'm trying to say, that may affect individuals surrounding those particular circumstances. And so uh, when we think about laws that are being placed outside the United States and we focus on how y- individuals function and operate within European countries, in most cases, uh, there's stricter uh, monetarization in terms of how individuals uh, walk about in society. And so I believe that even though an individual has a right to bear arms, and this is just my viewpoint, that accessibility to firearms as a whole, to be able to walk among society carrying, uh, a firearm for any matter, um, is going to create, when you pull that trigger, you're going to create uh, a level of some type of impact. What kind of impact, we don't know, but definitely there's going to be some kind of outcome, whether it be positive or negative. And why not, eliminate both of those threats, so we don't have an outcome as a whole that would lead to something that's going to be traumatic or impactful to other individuals that are surrounding that particular event.
So true. But we live in a society of stand your ground and open carry laws. You bring to mind another emergency medicine saying we tend not to focus on potential side effects when in the face of a defined life threat. And one can reasonably argue that although it is um, a better utopia for guns to be eliminated, as is the case in most of the rest of the civilized world, it perhaps would be a existence to be without guns when we have a long history of having been oppressed. Now, we won't solve this conversation today, but we are always also have to be mindful, going back another 180 degrees, that when we carry the presence of a firearm, then that empowers police and others to feel threatened and to use those stand your ground laws against us. So it's an amazing conversation and a circular one. But what I want to do, we just have very few minutes left. Um, and I just want you to kind of tell us what we should be thinking about, what we should be talking about that we haven't. And I also want you to kind of hone in on things that we as a community can do to be better empowered. And by empowered, that means for those individuals that do heed your call to bear arms, how can they best promote gun safety for themselves and their families? And we've kind of talked about the long-term societal approaches, but that's an ongoing political fight that Alpha and other organizations will take a stand and develop policies on. But just talk, if you will, on the ending part of this conversation on things that we can do to be empowered and safer in the appropriate usage of guns.
Sure. Well, one of the things that I found intriguing, I used to work as a corrections officer at Washington D.C. Department of Corrections. One of the things that I discovered that creates uh, a very intriguing algorithm related to gun violence is that individuals use platforms such as YouTube, Facebook, Instagram, things of that nature, and uh, they have followers. And so when you see individuals who are committing crimes or various acts as it pertains to gun violence, they're it's not being properly monitored. I believe that introducing laws that would help to identify various threats, and as well as being able to hold a level of accountability in place where uh, those particular uh, types of events are specifically monitored and focused upon, and basically cut off from the feeds are cut off from various audiences, so that way a ripple effect won't create a tremendous impact on individuals who are trying to watch or follow these individuals who who carry out these acts. Another thing that I also wanted to focus on is uh, within our school system. As you spoke earlier, you talked about the suicidal impact and the surge of suicides among young African American males. I believe that incorporating uh, within our school system, we don't have as much social work or psychological impact programs such as wraparound, things of that nature, that help to engage young individuals who come into an environment where they're coming from possibly environments of domestic violence. They come into they engage with other individuals who bully these young kids uh, because of how they look, or financial accessibility to certain resources that other kids do have, and that puts a tremendous impact on individuals psychologically, to the point where it lowers their value to themselves and their self worth. Being able to create an ecosystem for those individuals to help build a positive morale will help to provide a better uh, degree of mental health practices that will help support them over their span of their attendance being at the school. Also, I also believe that in enforcing the continuance of enforcing advocacy for extreme risk protection orders, gun license purchasing laws, to try to be uniform in a sense where uh, there is a continuous approach for advocacy in those regards to help continue the work, even though there are loopholes in certain instances where there are uh, gaps within the system. But the continuous practice of trying to enforce and advocate in those particular regards, I think, are very important. And then also, I believe that uh, also introducing new and fresh ideas, like I said in prior, we're operating off of an old system, old traditions. And now, in most cases, a lot of these kids are emerging with new ideas. We're dealing with a whole society where everything is becoming more virtual. Uh, by addressing and putting supports in place that focuses on surveillance of these particular areas, uh, is something that's going to have to change over time.
Indeed. And I hope that those that are listening have a V8 and realize that we don't get to have these conversations very often. This isn't what we talk about, but we have a stake in this. We are the ones that are victims of these gun tragedies. We are the ones that are proportionally victimized when we choose to carry guns. And it's not just gun safety, but advocacy for uniformly applied and fair treatments as relates to gun ownership. There's so much to talk about in this conversation, and I greatly appreciate you joining us, good brother. This has been a
Thank you.
fantastic conversation, and I hope that people have found it of interest and meaningful. And I hope that you'll continue working with our public health subcommittee and the Surgeon General initiative to formulate policies for the fraternity to consider in its advocacy efforts. So, as
Absolutely.
always, I want to thank our General President, Brother Dr. Willis Lanzas III, for providing us with this platform to flesh out these issues and to have these conversations. As always, I want to thank our 6 Deputy Surgeon Generals for the work they do, the yeoman's work and phenomenal content that is produced, and the 80 plus brothers that are a part of the Surgeon General Initiative. We will be back in 2 weeks. And until then, please be safe and be well. This is a tumultuous time out there. So thanks for joining us and all the best. Good night.